Welcome to EdMask, your channel for learning, education, and development. Today, welcome me again to this channel, and today I'm going to talk about addressing mental health challenges amongst the youth. When you look at mental health, see, mental health is a critical aspect of overall well-being, and its importance or challenges or effects amongst the youth cannot be underestimated. What do we mean? We mean that in the existence of mental health, we need to make sure that we don't take our focus from mental health amongst the youth. So at the beginning, I'll ask you, call everyone to be involved and then to be able to put a slot, to put effort, to join the struggle, to fight mental health amongst the youth. We see that in mental health, in recent years, mental health issues have been on its rise amongst the youth world over, and this has been shown in newspapers, on TVs, in the local community, and much of our youth have lost their life. And when you look at this, you realize that a few or little effort has been undertaken to see that we save our youth, our brothers and sisters, and then our parents and maybe other people within the society. So we realize that there are factors as to why mental health has taken this kind of route. We realize there are factors that as why mental health is taking a lead or is taking effect on our youth. One of the things I want to talk about in this discussion is that mental health is as one of its factors on the youth is social pressure, and this social pressure is an influence exerted by peers on other youth, and often this leads them into behaviors that are not necessarily agreed on or they feel comfortable about them. So what do I mean? I mean that because there's that social pressure, someone gets involved into or gets into mental disabilities because it's that pressure from the peers. And this comes in a way that sometimes it's because of peer pressure. Sometimes these guys or youth don't know even when they reach a point when they can't even separate or come to know as to when and at what point they get involved into mental issues because of peer pressure. And I would say social pressure influence exerted by their peers often leads them to engage in behaviors or make choices that may not necessarily agree with or feel comfortable with. So one gets involved into a situation, it gets stuck in there, not well knowing that this can lead him into mental health issues. Then another thing also I need to talk about is academic stress. You realize that academic stress is a common experience amongst university students, and it can lead to stress, anxiety, and depression. It occurs when academic-related demands exceed a student's capability to manage and adapt to them. Those of you who have gone to school, parents and brothers and sisters, you realize that even when you are at school, the pressure on the academic, or maybe the pressure from the lectures, the pressure and the competition amongst the universities, the pressure on the grading from the based on the grading that is put in an institution, sometimes makes students to go into mental disabilities. And this happens especially sometimes because there's a lot that goes into school, there's a lot that goes in around the colleges, there's a lot that goes around into secondary schools and so many and so forth. You find that because there's pressure of school fees, because the pressure of necessities, because there's a pressure of the little things that one has to use, the pressure on accommodation, the pressure on maybe clothes, competition amongst the youth makes them to feel that they don't have enough for themselves in academics, and the grading itself puts them at this kind of situation. So academic stress is something that one needs to look at when it comes to mental health, because it leads our students, our pupils, our brothers and sisters, students into stress, anxiety, and depression. Then another factor I want to look about is lack of awareness. Lack of awareness about mental health can lead to misconception around mental health illnesses, such as stigma that they imply weakness. When others have illness, pills will fix them, and even that they do not actually exist. There's a belief that kind of misconception, youth thinking that mental health is for the old, or maybe when they're given pills, maybe if someone is has mental disability, when he's given pills, the drugs cannot cure him or help him, and other little things. And sometimes some of them would say, that one has got that illness based on maybe the background, or maybe anything, even the medication, or maybe someone who works on him or is helping him might not be able to explain exactly what one would want to understand. And then in that sense, because of misconception around mental health and the stigma, then there's like that kind of weakness. And the belief that only adults have illness, and the pills can't fix the problem, then the youth will lose our youth in such a situation. Then there is a difficult in seeking difficult in seeking or following treatment, because most of our brothers, when they're given, or brothers and sisters, when they're given treatment, someone is getting treatment, then, or maybe sometimes because they have the stigma, they limit themselves into not going for treatment. So in the long run, by the time when someone comes in to give support, and then someone has already lost his ability to be stable. So looking at difficulty in seeking, following mental health, in that line, we've lost our brothers and sisters. Then there's also obstacle to access needed mental health treatment and resources, that even when one has that kind of acceptance, but then you find that there's some kind of limitation for someone to be able to get the medication. For example, if you went to the villages, if someone got maybe a mental disability, accessing the drugs, accessing the health facilities might not be easy because of distances, or maybe because of low staffing, or maybe lack of the capacity of the people at the stations, or maybe health facilities. So that one is also another factor that may lead to be so much stuck into mental health disabilities. Then also there's also limited awareness, limited access to mental health services. This contribute to alarming trends because of, as I told you, because of limited access, because of distances between hospitals, between health facilities, and mind you, not all health facilities have got specialties. So in the long run, because of limited access, then there is that kind of alarming trend keeps on growing each and every time. Then what implementing partners ought to do? What do we think one can do, or what do we think anyone that comes in to help, to see or to fight against mental health disabilities. How can we help? One thing I need to put up is develop comprehensive strategies to address mental health challenges amongst the youth, with ultimate goal of promoting mental well-being and resilience. Yeah, we need to find a way of developing strategies, developing ways, developing routes, developing like different kind of opportunities that can help to address mental health challenges, especially in the youth, so that we don't just look at them losing their life at a younger stage, and in the long run we find ourselves not able to help. And one of the things that I would take on is like my key objectives that I would want people to look at in this kind of situation. We need to raise awareness about mental health issues and reduce stigma associated with seeking help. Because of stigma, some youth have diverted or have stopped, restrained themselves from getting help. So because some of them fear, they'll call them mad. Some of them will feel maybe I might not be helped. Some of them would feel maybe I might not be able to get the drugs. So that kind of awareness needs to be talked about. Then we need also to strengthen the capacity of parents, partners, and the committee members to recognize the early signs of mental health problems in the youth. Unless we find ourselves like creating awareness amongst the parents, amongst the teachers, and then the community members, to be able to identify the early signs of mental health. If not that, then we cannot make any stride. So in this sense, I urge governments, I urge different partners, I urge leaders, elected leaders, to make sure if you're talking about such issues, either in parliament or maybe in your local constituencies, you need to look at an issue where we need to be building capacity of parents first, because these children live with their parents, those who don't stay in boarding schools. But then also we have teachers that even when you live, even when your parent is not around, then there's a teacher who is a second parent in the school. And in this sense, a teacher needs to be sensitized to be able be able to take care of your child who is mentally disturbed. Then the community itself, unless when the community is sensitized about mental health. Previously, we've seen people throwing stones to young kids, throwing stones to people who are mentally disturbed. And this is something which makes everyone cry. You just imagine your child, or maybe your teenager moving in town, and then he gets berserk, he gets mentally disturbed, and people are throwing stones to him because he's riotous. So we need to stand in. We need to come in and help each other, because everyone has got a child, everyone has got a brother, everyone has got a sister. And the long run, if we made our efforts all together, we'll find having something at least, I think tangible, to be able to help our brothers and sisters within this kind of situation of mental health. Then another thing also I need to talk about is we need to improve access to mental health support and services in the community. I said we need to improve access to mental health support and services and service in the country. So in all countries, we need to work as a team. We need to work as brothers and sisters to help each other. If country A or country B can support country A or B, then what's wrong with that? Why should you lose a young community? Why should you lose our young brothers or sisters in such a situation where everyone can help? So to me, I think countries need to make sure that they improve access to mental health support and services in health facilities by providing specialties, by providing drugs, by providing safe places for the people who need this kind of help. And then also providing leisure places in the local community so that everyone can access this kind of services and be able to build their capacity and the growth mentally, and then healthily, and this will help them to move forward and have a better and lively future for brothers and sisters. I also need to look at, I think I also want to talk about is we need to conduct research. We need to conduct research and gather data to better understand the specific mental health needs for the youth. Because in certain instances, you find that some of the services that are being provided are not youth friendly. So if we kept on giving programs which are not youth friendly, at the end of the day, we're going to find ourselves not taking any step into the development, or maybe fighting about mental health disabilities. So my take for this kind of discussion I'm putting it forward is that let's conduct research. Let's get information. Let's do things based on informed point of view. Let's have the data. How many people we have on mental health, that people are being disabled with mental health? What are the causes of mental health? And what are the numbers? Maybe the data needs to be kind of disaggregated. We know how many youth, then we have how many girls, they can also know how many boys, and then help each of the gender, and maybe what base can we put forward that can help each and everyone, not basing on gender. So such situations need to be, such atmosphere has to be there. There must be data. The power of data is very important. We cannot keep on saying we have the issue of mental health is very high. The issue of mental health is very important without numbers. There are brothers who are doing programs under mental health. Let's do research. Let's get the numbers. Let's understand why we have these numbers, and then we'll be able, that will help us to tailor programs, which programs will help us to help our brothers and sisters, the youth in development. And then I also thought about looking at proposed strategies, things that I think would work for us, me and you, to see that we can address mental health challenges amongst the youth. And one of them I looked at was I realized that we need to raise awareness about mental health issues and reduce stigma associated with seeking help. So in other words, we need to, in this sense, we need to look at how can we raise awareness? How can we make everyone know about mental health? How can we make everyone understand that mental health is everyone's cause? So in this sense, we need to make sure that we raise awareness about mental health issues and reduce stigma associated with seeking it. So when someone gets, let's say someone gets mentally disturbed, it should not be isolated from the community. People should get to know exactly why and when we should need to help or stand in spaces of everyone. Because this is everyone's choice. Everyone's yardstick to make sure that we work together to see that we raise a healthy youth in our community. Then another thing I looked at is strengthen capacity of parents, teachers, and the community members to recognize early signs of mental health problems in the youth. Yeah, we need to seek how best we can build the capacity, how best we can make sure that our parents can be able to identify signs of mental health, how best the teachers at school can be able to, or lecturers or professors can be able to understand this person has got a problem. How can we be able to help? How can we help? If the need is putting like places at school or maybe at universities which are meant to be to help those in need, those who need medication, like we've done in other programs, that when anyone can walk into a health facility, get drugs, or maybe there's some kind of follow-up on drugs. They need to also, sometimes they make even tracking, they keep on tracking the people who have got these kind of problems. we need to see that our parents' capacity is built. Parents need to know how to identify the signs of mental health. Teachers need to know how to identify signs of mental health, and our community members need to be able to recognize the early stages of mental health problems in the youth or around the youth, so that we don't have to get stones thrown to this kind of people who have got this kind of effect. And then also this helps to help us to reduce the numbers of our brothers and sisters who have struggled themselves. Like, you are sitting there. I remember I have a friend, I have a friend who lost her daughter. They had, as they were sitting in the sitting room having their prayers, one of her elder girl went went to her bedroom with her laptop, and after like 15-20 minutes checking on her in her room, calling her to that they have finished prayers, because she never attended the prayers. She used to attend prayers, but that day she never went for prayers. So what happened? Going to her room for 10-15 minutes or 30 minutes, they finished making prayers. Checking in her room, this girl had strangled herself with a laptop cable. And this is very absurd. Maybe they had issues they never talked about as parents. Maybe they had issues in their family they never talked about. Maybe because they didn't have anything, any scaffold, anything within their family that had brought such a moment to see that this girl has got a problem. And the long run, that's how my friend lost her daughter. But maybe if they knew how to identify such a signs, then it would be okay for her, or she would be okay for her to identify these signs and maybe able to seek help. Then another thing also need to look about is improve access to mental health support and services in the country, or maybe in the local communities, because you understand that mental health is not for the rich, it's not for the poor alone. It's cost cutting. So if you know that mental health is cost cutting, then why don't you help? Today is my brother, today your sister. So I'll urge different partners, colleagues, parents, teachers to improve access to mental health support services in all health facilities, in schools, in universities, to make sure that we cap this before we lose a number of our brothers and sisters. You've seen students coming from buildings, falling on the floor in the universities. You've seen students strangling themselves in the universities, and because of the issues I talked on earlier on. And then so that means we need to get service points in schools. We need to get service points, but also we need to get service points in a home. Let's not think that watching TV is the only thing that can make our children to settle. Because there's much that our children do in their rooms. There's today, this time around, you look at, there's so much. This is a digitalized era. There's much they watch on TV, and some of our kids, our children, our youth have even joined other spaces which are not good. You find that they're joining groups which are not good. You are in a home, and then the following day you see police coming to your home saying your children or maybe your daughter are getting involved into, or maybe they're part of this kind of group, and you never like it. You never like it. So why don't we work as a group and see how best we can help our children or our youth in our countries, in our schools, in our homes? I think government needs to put initiatives that promote this kind of awareness for everyone to be able to understand and see how best we can help. Then and then we also need to conduct research, gather data to better understand the specific mental health needs for the youth. So we need to make sure that we have enough data. Let's build the data for everyone to look at and then be able to help. Let's know that this, either this list A, list B, or maybe we would maybe, if the data given to us is that maybe in such a town and such a town there's increased number of mental health, then let's start from those kind of points where we are, then we come to one by one, so that we engage this kind of what. There's no way we can have a conclusive kind of point where we don't have enough data, where we don't have research. Even when we talk about mental health without research, at the end of the day, we can't work on mental health conclusively, and we'll never be able to help our youth to see that they have a healthy and positive life in their universities, in their communities, and all maybe schools. So let's help everyone, and then let's mobilize and see if we can get maybe enough funds to see that we can build this kind of centers, and then maybe have also counseling spaces where the youth-friendly spaces where one can come in and open up on the issues that maybe is pending, or issues which are pushing them into such problems. Then I would, in this sense, I also need to talk about what strategies can we be able to talk about. One of the strategies I think we need to look at, we need to have awareness campaign. We need to make that there is a campaign world over about mental health. Celebrating mental health days is not enough. Celebrating mental health days is not enough. I told you, brothers and sisters, our parents, that mental health, we need to have data. And if you have data, that data will help us to see how best you can engage with the issue of mental health world over. So if we have if you have a campaign, and this campaign is informed with the data, then that will be a blast. So in this campaign, we need to organize community-wide awareness campaigns to increase understanding of mental health issues, and debunk myths and misconceptions. Yeah, we need to make a campaign where we can debunk, can talk about the misconceptions, because some of these misconceptions have gone on year in, year out. Because there is no way you can tell me that you see that family has always had mental issues, and then you don't identify why do they have mental issues. What's the basis? Because there are even families which have not had mental issues. Maybe my parents were mentally disturbed because of the stress we had in the family, or maybe based on divorce, or maybe someone of other issues. So this time around, I'm in a family where there's no divorce, or maybe there are no issues in the family. But now I'm at the university, and I'm engaged, or maybe persuaded by the peers. So how can we help? So then another thing we need under awareness, I think we need to utilize media platforms. We need to look at radios, into TVs, social media. This one will help us to reach a broader audience and encourage open discussion about mental health. Let's have such programs on TVs. Why should you put programs which are not healthy? I see people flocking into churches. Someone is mad and then someone is taken to church. Why? That's all right. Prayer is very key. I would also encourage prayer, people going for prayers. But also we need to look at the root cause. What's the root cause? What is causing this? Is it because someone doesn't have to say prayers? That's why he's getting this kind of issue? Or maybe there's some other root causes that someone needs to detach himself from, and then be able to have a healthy kind of having his life, or having a well balanced life. So we need to look at that. Let's have programs, radio programs. Let's have TV programs, and then let's have social media platforms that can give such information to be able to build our knowledge, and encourage our youth to live a positive and encouraging life for the future. Then also need to look at collaborating with the local influencers and then community leaders to support and amplify the messages of mental health. Yes, we have elected leaders. We go to the community, we mobilize, and then we have leaders. What do the leaders do for us? This is a very key thing that we need to look at, because mental health, last time I told you that within 5 of us, around five, within 5 of us, 3 of us are mental. So how do you avoid? Because if how can you avoid this? You have three youth around, and the research shows that 3 are mental. Then why don't you look at such a signs and then be able to help them? Why don't we? Why do people who go to, like, who have spaces, who have got spaces talk about, or be able to amplify the voices for such a burning issue that is taking the lives of our youth? Still another strategy I want to talk about. The strategy we need to talk about is training and capacity building. We need to make that review. I said we need to conduct kind trainings. We need to have training sessions for parents and for parents and the community members to help them identify signs of mental health in the youth. Unless when we have the ability to train the parents, because these parents have much time with the youth. And then we have the schools which have much time with the youth. So if we don't have change agents, we don't have teachers that have the capacity to identify such issues of mental health, then that means we're not going any further. Then you also need to see that the teachers who are being trained, incorporated into so also need to see that teachers we also need to see teachers train teachers to incorporate mental health education into curriculum, emphasizing emotional well-being and coping strategies or coping skills. Yes, why don't we, if a university has got a curriculum, why don't you incorporate issues of mental health? Why should you make mental health to be a mental health course for a particular group? Why don't we incorporate mental health in the curriculum of a university, that every course at least has got mental health, at least some kind of space, some kind of a bit of curriculum that can look at mental health, at least, because we realize, brothers and sisters, we realize that there is the academic stress. So if there is academic stress in the universities, in the colleges, and in the schools, why don't we have that kind of curriculum that cuts across all programs to make sure that caters, or maybe our students, our learners, our youth in universities and colleges and schools get informed about of mental health, and how they can be able to overcome it, and maybe how they can be out of these kind of spaces of where they get this kind of where they're being influenced by their peers. Then I also looked at equipping local health providers with specialized training in youth mental health to enhance their ability to provide appropriate support. Yeah, we need to look at having specialties. People are being trained. Let's make it a point that at least each school, each university, or maybe universities have people who are specialized. Apart from the teacher or the lecturer who is teaching mental health, there must be in a school environment where there is a school nurse. Then this nurse has to be, or doctor has to be with that kind of speciality to be able to handle these kind of issues, and then be able to guide and counsel these kind of students that have fallen part of, or fallen into this kind of moments. Then I also looked at establishing youth-friendly mental health services. Here we need to collaborate with existing health facilities to create youth-friendly spaces with health centers that are working, that are welcoming and culturally sensitive. Yeah, we're looking at, if we created youth-friendly centers in schools, in universities, where everyone can be open to go and talk about this mental health, and maybe discuss their obstacles, then would have worked at least a stride, would have made a stride for everyone, for the parents, for the teachers, and everyone, the community, because that means we'll be able to have our kids, our youth are sensitized, and they will be able to live a positive and a healthy life. Then also we need to see that we need to provide training to health professionals on youth-friendly approaches to mental health care, ensuring safe and non-judgmental environment. Yeah, we need to see that the youth have professionals to work on them, so that one knows how to handle the youth themselves. Of course, if you don't have that, then that means some youth are going to object from accessing these medical facilities. So we need to have professionals, health professionals, who can help the youth to access to access medical help, and this needs to be in a youth-friendly environment, where we think that people who are being trained and non-judgmental. One shouldn't come and say, this one is already mad, this one is so and so, this one is so and so. And then if one comes in, I'll urge that if one comes in, take some kind of secrecy, so that you don't need to tell each and everyone, maybe for caution, where you need someone to be standing in for this kind of youth groups, or youth or any youth that needs that help. The environment, we say that the environment should not be judgmental, the professionals should not be judgmental. Let's see that we give appropriate support to each and everyone without judging them, whether they are poor or they are rich, or in any way they are, or in any way the way they are dressed, or in any way the way they talk, or in any way which culture they are coming from, or in any way which language they speak. Let's be universal. We should be inclusive in a way that we provide a service that will help our youth in the fight against disabilities and mental health, that support each and everyone that needs the service. Because you never know, the following day will be your daughter, to be your sister, or your brother, or anyone else. And then I also need to I looked at that school-based programs should be introduced in for mental health education as part of the school or curriculum. Then promoting emotional intelligence and the coping mechanisms, which I dealt about initially. That school curriculum should be promoting emotional intelligence and coping mechanisms. If someone got stuck, if someone got into this kind of situation, how can this person live a life? How can he continue with his studies at the same time, let's say, trying to juggle, or maybe trying to go through medication without losing each and everything? Then also need to set up peer support groups and counseling services within schools, led by the trained professionals and teachers, in a way that we need, after, if we put mental health specialists in schools, then we'll be able to see that these schools can be able to get counseling, and then maybe they would have the schools could create like counseling, peer counseling groups, which will help, maybe which will be able to recruit more of the peers, and then be able to talk about their issues, and then be able to discuss things that are running, or maybe trying to divert them from the real life that they are dating for. And then I also looked at conducting regular mental health assessments among the students to identify those at risk and provide other interventions. Because if we took on this kind of initiative, where we have assessment in schools, in universities, in the communities, maybe it could be done by the local leaders in the communities to assess and maybe identify those those in the community that are at risk, those who are in the schools that are at risk, or maybe in universities which are those who are at risk, then this one will help us to see that we have we can control on the numbers, or maybe be able to identify those who are at risk, and then be able to help them urgently as they might need the help. Then I also looked at one of the major things I also I'm trying to emphasize in this my presentation is I said we need to have research and also collect data about mental health, especially in the youth. We should not keep on lamenting about youth mentally disturbed, but we should also look at how we can have research and data and collect data about such instances, or maybe within the youth. We need to see that we collaborate with the local universities, research institutions, and to conduct surveys and studies on mental health status of the youth. This could be within the community where we are living. It could be in schools. It could also be in universities themselves, or maybe in towns. We've seen many youth in towns loitering around. People are getting addicted to drugs. People are always in the bars drinking. Some of them have taken so many things that sometimes some people don't want to talk about. But this one will help us to, if we've got partnership, we've collaborated, communities collaborated with universities, and then that would help us to get enough data and be able to see that we can be able to, if we get that data, we can be able to analyze and identify prevalent mental challenges and tailor interventions accordingly. Because if universities, if you got a partnership with the university, then that means that the university will come to make research, and then they will get that data, and that data will be analyzed, and then they will be able to have an intervention based on the data that is being identified or collected. Then you can also use research findings to advocate to increase funding, and policy support for youth mental health initiatives. Because of the data or research that is made by the universities or maybe institutions in the surveys, this data will be able to inform our advocacy for increase of funding. So this one can even be done by private institutions, can be done by NGOs, and in the long run, this information will be able to help to increase the funding by government, by NGOs or different partners, but also help in support for youth mental initiatives. In my conclusion, I'm saying my followers that addressing mental health challenges amongst the youth requires a manifested approach that involves collaboration among its various stakeholders, including government, community members, schools, health providers, and NGOs. So it is kind of a wide thing that everyone should get involved. We should have, I said we need government, community members, schools, health providers, and all non-government organizations need to come together and build consensus. See how best we can help our youth who are becoming vulnerable to mental health. And by implementing such strategies, I think this can create supportive environment that fosters mental well-being of the youth individuals, leading to healthier and happier communities all over the world. I thank you, brothers and sisters, my followers, for following me. I ask you to subscribe, like, and share. This is Ed Mask, your channel. Bye.